I'm sorry to say this, but curing cancer won't be easy. And despite what you read in the news or what you hear from politicians, there is no silver bullet. We're not going to have one cure for all cancers because cancer isn't one disease. It's hundreds of diseases with a common name. And like most complex problems, it will take years of research to find effective solutions. But let's be clear about something. While there will be no quick fixes, we already have the tools to prevent hundreds of thousands of cancers from happening in the first place. We know that cancers develop from precancerous cells. That means there is time before a tumor becomes cancerous. And during this precancerous phase, the cells don't yet have all the characteristics of cancer. They haven't started to invade surrounding tissues or spread around the body. This makes precancerous cells easier to target and kill than actual cancer cells. And by doing so, we can prevent cancer from ever starting. So why don't we just focus our efforts on targeting these precancerous cells? Well, for one thing, it's much easier said than done. You see, precancerous cells are, well, kind of normal. That means they look and act like regular healthy cells, which makes them really hard to identify. If you could easily spot them, we would already have done so. But even if we had some way of identifying precancerous cells, killing them comes with its own set of problems. The problem is that while we might manage to kill the precancerous cells, whatever treatment we use could also damage healthy cells. And the more similar the healthy cells are to the precancerous cells, the trickier it is to find a way to destroy one without harming the other. But here's the good news. We do have ways of dealing with this problem. One way is to use drugs that only target cells that are dividing. Since both precancerous cells and cancer cells divide more rapidly than healthy cells, this allows us to kill the abnormal cells without damaging the healthy ones. Unfortunately, this strategy doesn't work for all types of cancer, especially those that arise from cells which don't normally divide, like the cells of the prostate gland. So we need other strategies too. One promising approach involves taking advantage of the fact that cancer cells have damaged DNA repair mechanisms, which means that their DNA is constantly being damaged. By finding ways to make their DNA even more unstable, we can basically make their DNA worse than it already is, leading to cell death. Another promising approach is to starve cancer cells by cutting off their food supply. Cancer cells often grow rapidly and require lots of nutrients. So if we could develop drugs that block the growth factors that stimulate this rapid growth, then we might be able to starve the cells. But again, these approaches won't help all cancers, which is why scientists are also looking at ways to boost our immune systems to recognize and kill cancer cells. Essentially, we want to turn the body's own defense system against cancer. There are already some cancer treatments that work this way, but they tend to only help a small number of patients. Researchers are working on ways to make these immunotherapies effective for more types of cancer. All of this is to say that while there will be no single cure for cancer, there are many potential ways to treat it. And we already have the tools to prevent hundreds of thousands of cancers from happening in the first place. With more research, we can add more weapons to our arsenal. So keep funding the research. Don't fall for false promises and trust the science.